have the lower limb now laying on the table, and we are looking at a posterior view here. So I'm going to remove some of the superficial muscle groups again to get a deeper view. When I do that, I can see the femur. So the femur is going to be right there. If I look up here, I can actually see one of the coxal bones there, and here, this is the ilium. So this is ilium right there, and that will be the iliac crest right up top there. Rotating anterior, again, I can have another view of the iliac crest. If I view down here, I can see the pubic bone. So pubic bone is going to be another part of that coxal bone. These are 3 fused bones, and right there, pubic bone. Also, we can't directly see the bone, but I think it's worth pointing out here that this bony prominence is going to be your ischial tuberosity. So this is a prominence that you'll be able to feel. It's also one of your sit bone, or it's called your sit bone because you actually sit on that portion. And I'm just going to remove the hamstrings here to get a view of the posterior side of the femur at its distal end. So that's right above the knee joint right there. And just viewing from this angle, we can actually recognize the lower lumbar vertebrae. So this would be L5, lumbar vertebrae 5, and then right down here we can see the sacrum, and then finally down here the coccyx. So a few more recognizable structures. Also, while I have this view, I just want to point out the pubic symphysis shown in blue here, and that is going to actually be made of fibrocartilage. So that is what goes in between the 2 pubic bones. So viewing from the posterior view, the calcaneus is clearly visible here. If I rotate to a medial view, now I can see the tibia, and this structure right here is the medial malleolus. Both inferior and anterior to that is going to be the navicular bone. Then looking at the long bones here in the foot, these are called the metatarsals. So this is going to be the first metatarsal. We also have a good clear view of the 5th metatarsal down here. From this view, the phalanges cannot be seen individually. If I rotate to a lateral view, over here, this is the fibula, and the specific bony marker that we're looking at is the lateral malleolus. Rotating back to an anterior view, we can see the patella encased in ligaments and tendons here. So the patella is going to be right there.